Welcome back to another episode of the Better Health Bookshelf. And this week I'm featuring the book Dentistry Made Easy, The Consumer's Guide to Oral Health and Smart Decisions. And I'm joined today by its author, Heather the Hygienist. Heather, welcome.
Hi, thank you so much for having me, Mike.
Yes. I read the book cover to cover, Heather, so we're going to talk about it. This is a topic that's near and dear to my heart for several different reasons. But before we get into the book, Heather, you have literally decades of experience as a hygienist. Can you tell us a little bit more about your background and what you're doing today?
Sure. I've been a dental hygienist now for over 30 years. I'm also a certified biological dental hygienist and a myofunctional therapist. So I'm very much into expanding and always learning how to be a better provider, because I'm very, very passionate about health and how the teeth affects our overall health. But I also have an oral care line that is an all-natural oral care line that doesn't contain any chemicals or anything. So I'm also an entrepreneur. But I hope to be able to bridge the gap for people that are really needing to understand how important their oral health is and kind of point them into the right decision as far as what products they need and how I can help them.
Yeah, and your entrepreneur venture, congratulations on that. I was checking it out. Very cool. We'll talk about that because, again, I'm interested in that. But remind me, Heather, this is your first book, correct?
Well, that was my first. And then I also wrote a children's book.
Yep.
Yeah. So, but that's
okay.
First book.
And you have another one coming out, which we'll tease in a little bit too. So,
Yeah.
Okay, very good. Well, this one's pretty fresh off the press. So it's been a few months that it's been out there. And, as I mentioned, I've actually helped several dentists publish books over the years. Ironically, several biological dentists, dentists who don't use fluoride, don't use mercury. At least that's my definition of a biological dentist. And as I was sharing with you, my one dentist, he was a client first, and then we became friends. Literally, my wife and I would go out with his wife, he and his wife. And then I finally became a patient, and my whole family became patients of his. Great dentist, really opened up my eyes to mercury and fluoride and all the issues with that. So we'll talk about that. But unfortunately, he retired. So he did sell the practice. I'm still going to the young guy that he sold it to. But, dental health, Heather, as you well know, has huge impact. I mean, the more people are, there's a lot of stuff coming out today, now about how much impact your dental health has on your whole overall body, correct?
Absolutely. I mean, if you think about it, there's not a fence in our body. So whatever you stick into your mouth, which is the vascular part of your whole body, is going to get into your bloodstream. So if you think that bacteria or infection is somehow magically going to stay inside your mouth and not get into your blood or your organs, I mean, that's a real problem. So I think getting people to understand that you can eat clean all that you want, you can exercise all that you want, but if you have disease inside your mouth, you have systemic disease. So, my whole passion with the book is really trying to educate people and get them to understand that you may not have symptoms, you may not be feeling pain, but that doesn't mean that you're healthy.
Right. And, there's inflammation, there's all kinds of things. So I want to get into that. But before we do, you mentioned, and I mentioned biological dentistry. Can you share what that means? Because I'm guessing a lot of people are probably hearing that for the first time.
Yes. So basically, you have your mainstream dentist, your DMDs, your DVSs, all go to the same school. It's basically a degree in one or the other. It's the same thing. But your holistic, your biological dentist, there's not necessarily a degree for that. It's additional learning. It's additional courses. And it's really looking at the mouth instead of it as just a compartment into how it reflects for the entire body. So we look at the whole body, not just the mouth, because again, your teeth are organs, they're linked to other organs. And in dentistry, they're just going to focus on that one tooth, whereas in holistic biological dentistry, we're going to look at the entire person. what's going on with the whole body. So we also try in like biomimetic dentistry, try to utilize, different products that are going to minimally take away from your tooth structure. So we protect as much of your tooth as possible. Once you drill that away, you're not, going to regrow that. So it's minimizing how much tooth structure is removed. It's really focusing on the whole body and getting to the root cause. And I think that's something that even in medicine today is really ignored. We tend to just deal with symptoms and we don't tend to get to the root cause. And what I want to address is the root cause and help people find out, if they are getting cavities all the time, why is that? If they have gum disease, what are the underlying root causes that could be contributing factors in the development of periodontal disease? So just really helping people understand, what it is that they can do for their oral health and how to navigate, because it's really something that people are just overwhelmed by.
Yeah, and probably a lot of times not even aware, right? They're just not aware of the impact and the connection. So, I mentioned I was not aware of, I was one of those people that wasn't aware. It wasn't until I started helping my client / friend / dentist write his book about mercury that all of a sudden I'm like, oh my gosh. As someone who grew up in the 70s, where they were just popping amalgams, the silver fillings that, most of us had growing up, whether or not we necessarily needed it, we got it. But, the dangers of those, I was not aware of that. I was not aware of, fluoride and the issues of that. So I know that's just part of your book, Heather, but it's something I believe in. I've actually helped 2 different dentists publish 2 different books about this, but it's near and dear because it's something I don't think a lot of people are aware of. So can you talk a little bit about fluoride and the issues with that, and then also mercury?
Yes. So fluoride has been the standard of care in dentistry since the 1950s. But are you saying in 65 years we haven't come up with something better? Of course we have. It's just that dentistry is so set in its ways, and it's very, very difficult to get them to change. Our teeth are actually made out of 97% hydroxyapatite crystals. So fluoride is not something that your body needs. It is not an essential nutrient. And the reason why they say it helps is because it can produce fluorapatite, which is a form of monohydroxyapatite. But you don't need to have a poison, a mutagen, a halogen in your mouth. It's unnecessary. Why not use something that's bioidentical to your enamel, aka monohydroxyapatite? Because then there's no poison label needed. We don't need to poison ourselves to good health. I think we really just need to change that paradigm, because it's not how much fluoride that you have that's going to impact your teeth. If you get a cavity, I guarantee you it's not from a lack of fluoride. You're being inundated with fluoride. Fluoride is in most water. It's in teas. It's in Teflon pans. It's saturated everything. So you can't get away from fluoride as hard as you try, really. We're just, unfortunately going to be exposed to it. So if you develop a decay, a cavity, it's because your saliva has dropped below a 5.5. It's too acidic. So we need to alkaline that mouth, right? We need to address diet. What are you eating? An ultra processed diet? Are you having poor home care? There's a whole misconception that sugar causes cavities. It's not sugar. It's sugar plus plaque forming an acid. And that acid is what is eating away at that healthy tooth, making it soft and sticky. So increasing fluoride is not your answer. You want to get to the root cause as to why are you developing decay in the first place? Are you breathing through your mouth? Because dry mouth is really the number 1 cause of decay. So we need to address airway issue. Is that something that's medication related, airway related, diet? Are you getting enough vitamin D3? These are super important things to know. Also, sometimes people have an MTHFR mutation, and just understanding that their body is not able to methylate properly and supplement accordingly. So again, getting to that root cause, we want to find out if this person is chronically developing cavities, why is that? And it's not from fluoride. And then nowadays we really don't use mercury. Mercury hasn't not really too relevant anymore. They have pretty much gone the way of composite fillings, but it used to be, like you said, back in the 70s and everything, that mercury was the way to go. But they've known since the 1800s that it was toxic, and somehow sticking it that close to your brain was okay. Yet if you broke a thermometer in a hospital, the old one, you'd have to have the hazmat people come in and shut down the entire floor for that amount of mercury. So thankfully we have gotten away from that, but there is still, because people still have these fillings in their mouth, it's still leaching mercury vapors into your system. And products that contain hydrogen peroxide can exacerbate that and leach that into your body as well. So you want to avoid hydrogen peroxide products. And you really want to get rid of the mercury fillings in your mouth. But it's important to not just go to any dentist. And this is where understanding the difference between biological and holistic dentist is important, because they're going to remove that toxic substance out of your mouth properly. Once you start to drill it, Mike, it's just releasing that vapor. You're going to expose yourself to way more mercury than had you just left it in your mouth. So you want to have the mercury safe removal system done. You don't want to just have a mercury-free dentist do it. That's not the same. So you want to have that done according to the right protocols, so you're not exposing yourself to all of this mercury vapor and toxicity. So it's important to have it removed properly. So definitely I would encourage you to go to a biological or holistic dentist to have that done. But thankfully we are not really using mercury anymore. It's kind of, really not the standard of care anymore in dentistry.
Yeah, well, that's good news for sure. I haven't had a cavity in years, so I don't know. But yes, all my amalgams, the silver fillings were taken out, replaced with composites. And yes, the fans, I can remember the dentist had all the protocols, and it was an amazing experience. I mean, he was really good. Heather, is it your recommendation? Because I'm guessing there's still, like you said, a lot of people, 50s, 60s, 70s, who have the silver amalgams in their mouth. And my wife, who's a very sort of black and white, she doesn't complain about anything necessarily. She was even saying, like, before, she noticed an improvement with headaches. She was getting headaches before, and it wasn't until she had the amalgams removed that the headaches went away. That's when she made the connection. Mm-hmm. And she very much believes that was, due to the silver in her mouth, the mercury in her mouth. Is it your recommendation that if you have a silver amalgams, no matter what age, they should be removed?
I would, absolutely. I've never had a cavity, Mike, and I was always testing positive for heavy metals. And it's because of the atmosphere that I work in. All right. I'm working in an environment where they're constantly drilling these old amalgam fillings and putting crowns on. But that, it's an old office building as well, which in my next book, I actually talk about how toxic the environment is inside of the dental office. And the air quality it's so bad, honestly, it really should be shut down. It's a shame that, things haven't improved that way. Hopefully with newer buildings and HEPA systems that will improve. But, when you're vaporizing this mercury vapor, you're not going to smell it. There's no indication that you're being exposed to it, but it is gas. And
it's
very, very toxic.
It is. And I think one takeaway from anyone listening or watching, if you have those silver amalgams, do your research. It's something you want to be. And this is not like the sky is falling. This is very real. Mercury is a poisonous gas. Like you said about the thermometer breaking, it's scary. And they were using that. So that's not the focus of the book. You mentioned mercury, you mentioned fluoride in the book. Heather, what's the big idea here with the book? Like what you mentioned early on, it's a guide. But at a high level, and knowing probably a lot of people, their oral health is not as good as it should be, what do you want people to know about? Like, what are you trying to accomplish with this book?
Well, I just hear it all the time. People are just so surprised when they come in and see me, say they haven't been in 2, 3 years, and then they come in and I am seeing all this disease, all this inflammation, and they just are just so, well, I brush my teeth every day, how can this possibly be? But I try and give them an analogy maybe that would help, and that is if we have a vehicle, right? And every 3 months we need to make sure we get an oil change in that car. If we never put oil in that vehicle, what's going to happen? You're going to blow the engine, right? That's an extremely expensive repair. You're never going to feel gum disease or decay until it's too late. So I think people are thinking, well, nothing is hurting me. I'm fine. I brush my teeth. I'm good. But that isn't the case because it's a silent killer, really. What's holding your teeth in place is your jawbone. Your bone has no feeling, but it can rot and you're not aware of it. The signs and symptoms of bleeding, either when you brush or floss your, sometimes bad taste or odor in your mouth, loose or shifting teeth, that's all a sign of bone rot. But with cavities, you're not going to feel a cavity until it hits the nerve of the tooth because your bone has no feeling. So it's getting people to understand that you're not going to feel something until it's too late and you need to do prevention. It's like getting that oil change. If you were to come in, if you're somebody that builds a lot of tartar, you need to come in for that oil change every 3 months. You got to get your teeth cleaned. That's how you stay on top of it if you're somebody that's more prone to gum disease. Now, I usually find that people fall into a category of either gum disease prone or cavity prone. Sadly, sometimes people fall into both categories, but you're usually one or the other. So if you're somebody that you're more cavity prone, don't tend to have gum disease, gums are pretty healthy, then yeah, twice a year, keep, a routine with going every 6 months to the dentist for that. But you have to be preventative. You have to be brushing. You have to be flossing. You have to get your teeth cleaned. I mean, ignoring the, most vascular part of your whole mouth and then getting upset at the dentist when you have a $10,000, $15,000 treatment plan because of your neglect, that isn't our fault, It's getting people to understand, had you been proactive, had you prevented this disease, you wouldn't be in this situation. Because unfortunately, by the time people realize that they have a problem, they're so far gone that it's extremely expensive, it's painful, it's depressing for a lot of people because now they realize that, oh my goodness, I'm going to lose my teeth, that's how bad it is. So I really just want people to put more effort into their oral care, understanding that it affects your entire body. I mean, gum disease can cause heart attacks, strokes, diabetes, pancreatic cancer, colorectal cancer, Alzheimer's, and dementia, all from the bacteria in your mouth. And that's why I said there's not a fence between hearing care. With a nitroglycerin tablet, right? You stick it underneath your tongue, it bypasses your GI tract and goes right to your heart. So does all that plaque. Right? All that plaque gets into your heart, clogs your arteries, periodontal disease. It's a disease that is so easily prevented. It's just people need to really understand it. And I know it can be intimidating. You see someone in a white coat and you're like, I don't know what they're saying. I have no idea. And I really wanted to teach people when they hear, hey, you've got a cavity, I wanted to give them tools to know, okay, if I have been told that I have a cavity, then I should see a stick here. This is what it should look like on an X-ray. I just really wanted to give people the tools to make more informed decisions and give them some power because it can be such an overwhelming thing. People are so fearful of the dentist, but I wanted to give them tools that would empower them.
Yeah, I mean, it's, as you said, it's critically important. And I've, read a ton of books. I'm very interested in cardiovascular, heart disease, overall health, functional health. And I cannot recall how many times, it was so eye-opening, Heather, that I'd keep hearing about how inflammation in the mouth, like everything you just shared, how it has direct impact. So you might be thinking, I'm working out, I'm doing this, but I haven't been to the dentist in 5 years. Guess what? Yeah. When I was reading your book, the one, I don't know if it was a chapter or a section, but it was the chapter, the part on X-rays. I was like, I hope she talks about X-rays and how you don't need them all the time. Because for some reason, I just hate X-rays, dental X-rays. But that's not the case. I mean, you recommended that. So how often should you get a full mouth X-ray?
So it's the only diagnostic tool that we have, Mike, to see your bone level. Like we can't, we can't just like look inside your mouth and be able to gauge where those bone levels are at. We cannot see in between the teeth without digital X-rays, right? And thankfully, because digital technology has changed, the amount of radiation is so minuscule. For those people that are like, oh, it's radiation. You know what? If you're that concerned about it, you can wear a thyroid collar, but to be honest with you, even the ADA says it's not even necessary. So it's come such a long way since the 70s. But if you are somebody that tends to have more issues with your bone levels, you really need to have a full set of X-rays every 3 years. And we typically take checkup X-rays once a year.
Yep.
Again, we want to try and prevent something. So if we can catch something early, and that would equate to less money, less invasiveness, and being able to be more proactive. Whereas people who I'm never getting X-rays, and then we find something, it's too far gone. And what benefit was that of you? It didn't serve any purpose. So really just trying to be more preventative. Now, you don't need to have X-rays every single time that you go. Of course not. But your checkup X-rays, your bite wings once a year. If there is an issue, if someone comes in and they say to me, I have a toothache on the upper left, I'm going to take a perioapical X-ray because I'm going to want to see the root of the tooth, and I'm going to take one bite wing on that side. So typically I would take 2 X-rays if someone comes in and tells me that they have an issue with something. But if every single time they're taking your bite wing X-rays, that's overkill. You definitely don't need to have it.
Throughout the book, you mentioned, mistakes and common mistakes a lot of people make. Are there any, we've touched on a few here, Heather, but, what are some of the big mistakes, most people make with their oral health?
Well, not flossing. They use those little cheaters. I hate those things because I think they give people a false sense of, well, I floss every day, but you cheat because that little tool cannot possibly go underneath.
Get around.
And the way that I describe it, if you read the book, that you know how I talk about this, and that is our teeth poop, right? Every single day, our teeth poop. Brushing gets off 60% of the poop, but the rest is in the toilet bowl. And that's the space between your tooth and your gum. That can only be cleaned out with manual floss, right? So those little cheaters are only going to clean maybe 1 to 2 millimeters down into the bowl, whereas manual floss will go all the way down to 4 millimeters. Now, if you've got periodontal disease, gum disease, and those pockets are 5s, 6s, you need a water pick because that's really the only way that you're going to be able to clean past a 4 millimeter pocket. Manual floss is limited. So a water pick is really a necessary tool if you have pockets deeper than 4. But, honestly, it's understanding that you have to floss the teeth that you want to keep. Maybe move it into the shower. Keep it around you, make sure you're doing it properly, change out your brush head every 3 months. As soon as you wake up in the morning, you want to brush your teeth, because again, they've pooped all night, they're excreting. So you want to brush, get all that junk off of there, and not brush 30 minutes after you eat. I think too many times people are thinking they're doing the good thing. They brush right away after they eat, and that's actually more damaging because your saliva is your natural protectant. So it's designed to remineralize your teeth. You don't want to disrupt that process for 30 minutes. You can rinse your mouth out with water, you can chew gum, but don't be brushing your teeth for 30 minutes after you eat.
Yeah, well, that's, and I don't recall reading that because, oh boy, I like those cheaters. I've got very tight teeth, very fortunate, very tight teeth, which makes it very challenging to get around them.
Right fingers, though. That's why I have my YouTube channel. So if you use your middle fingers to wrap that floss around, because too many times people are
right.
No, you can't do that. You have to use your middle fingers. And then that will give you the index fingers and your thumbs to get to the back teeth. So on my YouTube channel, I actually have a video that shows you how to do it properly. Because I know, especially with men, they have a hard time getting their fingers in their mouth. But there is a technique. It does make it so much easier. I don't like floss that is made out of Teflon, like your Glide or your Colgate Total, because it contains PFAs. You're getting that into your bloodstream as well. And it's so slick that it kind of slips right over and not really serving the purpose. So I like more of a natural fiber. That's one called Listerine Ultra Clean. That is a really good product I do like. But you really have to be manually disrupting that. You got to clean out the bowl.
Yeah, that's a good analogy. What about, just out of curiosity, and again, I don't recall in the book, but I think you may have mentioned it, but I've become a fan of, this ultrasonic toothbrush I use now, which is obviously using the power of the toothbrush pulsing at a high rate to really get in there. Do you like those toothbrushes?
Love them. Yeah, actually, my favorite is the Burst, and I like that because it uses the ultrasonic technology, Mike, but it is a subscription. So every 3 months, you can have the head come to you, which is only $7. It's very economical. But they're the only company that actually guarantees a toothbrush for life, which I love that they stand behind their product. Mine actually broke after 4 years. I sent them a little video. They replaced my toothbrush, no problem. So it uses the ultrasonic vibration, which is, 5,000 strokes per minute. It's not how hard you scrub your teeth, Mike. It's the length of time that you spend brushing. So that's why I like the electric toothbrushes that have the automatic shut off at 2 minutes, because it's a long time. People are like, oh my gosh, it's forever. Yeah, 2 minutes can feel like forever, but you want to make sure you're angling the bristles, because too many times people just put the bristles directly on the tooth surface and don't realize that they need to be brushing the gums. Plaque forms for your tooth and your gum. So you have to angle down into the gum at a 45-degree angle and then up into the gum at a 45-degree angle. And again, I have a YouTube video on the proper angle of the toothbrush. Always use a soft, not how hard you scrub them. You could use a Brillo pad for 30 seconds and the plaque would still be there. So it's the right technique. It's stimulating that gum tissue and just removing that bacteria effectively with an ultrasonic brush.
Yeah, after I started using one, I was so proud of myself because I really look at my teeth and I'm checking the tartar and I know where the inside of my lower jaw and all where it gets. And I went into my dentist, the hygienist. I was talking to her, and I was so proud. She's like, "Oh, your teeth look really clean. That's good. I'm not digging out a lot of stuff." And I was telling her how I was using the toothbrush, but then she also instructed me, just like you said. She's like, "Well, you want to make sure that whole angle, like you just mentioned, because I wasn't doing that. I wasn't angling down or angling up into the gums, but I try to do that now."
When I do that, my gums bleed, and I'm like, "That's because your gums are infected."
Right.
They should never bleed. Yes, bleeding might be a common thing, but it is not normal. Bleeding gums is not normal. So that's a sign of infection, right? If I were to touch someone on their arm and their arm started to bleed, that isn't normal. So we want to get to the root cause. What's causing it? Is it biofilm? Is there the tartar underneath the gums? What's the underlying root cause as to why we're seeing this infection? I mean, back when they were in slavery, right? What would they do when they would buy a slave? They would have that slave in their mouth. What does that show you? I mean, it's going to show you so many things. It's really where, we can quickly and easily see if there is active disease going on. I mean, when you go to a medical doctor, they have to run a bunch of tests, find out what's going on. But we can, within 2 minutes, determine so many things inside the mouth that could be underlying root causes that, why aren't your cardiovascular doctors asking, hey, when was the last time you had your teeth? I mean, this is like a tragedy. If they're on statin drugs, then why aren't they having CoQ10 recommended as a supplement? Because science shows CoQ10 helps your body for somebody that fights with periodontal disease. It actually helps kill that bacteria on a microcellular level. So these are the kinds of things that I wish we would be able to work hand in hand with, medical doctors, but there's just this huge gap, where we think teeth is one part of the body and, everything from the neck down is something else, where we really need to bridge that gap because it's really where your true health starts is your mouth.
Well, I think, your book is definitely helping bridge that. So for the folks that are, buying it and reading it and, doing what you're suggesting, obviously they're at a head start. Obviously, we want all our listeners to go get a copy of it. Heather, as we get ready to wrap up here, I have 2 more quick questions. One, we've thrown a lot at our listeners: mercury, fluoride, this, that, and the other thing, all important, obviously. But if there was just one thing, if there's somebody who's listening who, again, they're listening because they're in tune, they want to have better health, they want to do the right things, what's one recommendation you would give that person?
I would say really support your oral microbiome because your mouth is a mini immune system, and supporting it, giving it what it needs is going to help you systemically be healthy. So don't um, separate the two, really start paying attention to what's going on as far as the signs and symptoms in the mouth that is going to affect your overall health, and really think about your mouth in a completely different way, and start treating it with the love and respect that it really needs, and go to the dentist, make that appointment, start flossing, start taking it more seriously, because you're not going to regrow your bone back, right? Once you lose it, it's not coming back. So it's so important to prevent that. And for the people that say, well, I don't have dental insurance or whatever, there's dental hygiene schools that you can get your teeth cleaned for extremely reasonable costs. Yes, you might be there for hours and hours and hours, but you'll get the best cleaning of your life, right? It's under an education setting. So there's always a way to get the care that you need. It's just you need to make it a priority. And I think too many times in our society, we don't make it a priority. We get our nails done, or our hair done, but we don't think that we have the $130 to get our teeth cleaned. I mean, you just need to start changing that paradigm, make that shift,
Well, now I got a couple more questions, so we're going to go a little long. I know you're working today, but just one. If someone just had to set a budget, let's say they don't have dental insurance, because we're still not talking a ton of money here, but what would you budget for an annual dental care program, twice a year, cleanings, just roughly? I know it's different in different parts of the country, world, but just roughly.
That is a really good question, Mike, because I'm so passionate about just the whole insurance thing. So many times people are letting their dental insurance their oral health, and you just cannot do that, because dental insurance is more like a discount plan. It is not like medical insurance, and you really have to change your thinking on that. And even if your insurance doesn't cover it, you still may need it. The benefits of insurance have not increased since the 1980s. I mean, it's still $1,000, $1,500, $2,000 since the 80s. Dentistry is 10 times more expensive since the 80s. So you're not going to get hardly anything done for $1,000 to $2,000. One crown is like $2,000. So you're going to max out your benefit if you had to have one crown done. So you can't let insurance dictate what it is that you need. But if you are proactive, right? If you are being preventative, and say you don't have dental insurance, there's many offices like my office, we offer an in-house plan. So for $300 for one person, that would give you, I think it is $300. That'd give you 2 cleanings, 2 exams, and a set of Xrays every year. And then 20% off any dental work. So God forbid you have filling or something you need it done, you get 20% off. I mean, so there's lots of different plans, that you can see if are available to you with your local dentist or you're with. But there are things that you can do. So I would just really encourage people to not let their insurance dictate what it is they need.
So for that person who is healthy and, their oral health, they feel like it's good. There's nothing going on that they're aware of, but we're talking under $1,000 a year. And to your point, they're spending that much on, so that, I just wanted to make that point.
Spending that in insurance premiums to pay for the plan.
Yeah,
so,
right.
It's like $100 a month that they're being charged, and their benefit is maybe $1,500. I mean, what is the purpose of having it in the first place?
That's a whole other subject.
Put that money towards something else and get, be more proactive. And unfortunately, I wish that dental insurance was covered under medical insurance, but I did actually write RFK Jr. and propose that to him. So maybe more and more people can reach out to him and say, you really need to address this.
So another question that just popped up in my head as you were talking, Heather, what about someone who maybe they haven't been to the dentist in a while, they've moved, and I don't want to go here right now. I know your new book is probably a little more in tune with the state of dentistry and what's going on as a whole, but how would you advise, in a succinct manner, how would you advise someone to look for a dentist? What should they be looking for?
There are websites you can go on, like for biological and holistic dentists near me. Granted, they're not going to be taking your insurance. So if you're thinking that you're going to find a great provider and they're going to be in network with your insurance, think again. If you're somebody that's very, very serious about, okay, I've got an autoimmune issue or I've got some disease, I need to figure out if my mouth is the root cause, you need to get over to see someone that is equipped in understanding that and getting to the root cause. They have cone beam Xrays. Again, they're looking more at the holistic body as opposed to just the mouth. So, you know, your I think it's international. I can't remember the.
There is an organization.
Yeah,
you're right.
Yeah, there an Academy of Biological Dentistry. So I mean, if you just go and do a Google search of a biological or holistic dentistry, you should be able to find somebody. I know that they are few and far between. Sometimes you do have to travel, but just please avoid the Aspen Dentals, your clinics, because honestly, the care is terrible. They don't make any money on filling, so they don't diagnose when they could save the tooth with the filling. They wait until it turns into a root canal or crown, because that's where they make their money. I mean, I'm sorry, that is the reality of dentistry. That's just, it is true. And in my next book, The Great Tooth Deception, Revealing the Dark Side of Dentistry, I really do go into that. I've seen it firsthand. It's happened time and time again. I have friends that will go to an Aspen Dental. They'll show me the treatment plan. I look at it and I'm flabbergasted at, you know, either there was teeth that were treatment plan that didn't need a thing, or there was grossly misdiagnosed teeth on there that should have been that were not. So, you know, it's very tragic, but it's really the system, I think, that is setting it up for failure.
Yeah, it's quite interesting, and like I said, when that book is published, let's reconnect, because I'm very interested in that. I've heard a lot of horror stories myself from different places. But Heather, before we wrap up, I'm interested in knowing more about. I checked it out, your own product line. Congratulations on doing that. It's no small feat. Can you briefly describe your product line, what you offer, why you offer those products, and where people can check those out?
Yeah, well, like I said, being a hygienist for so many years, you kind of hear the same problems over and over and over again, and that is my gums still bleed, my teeth are still sensitive, and I'm still getting cavities despite all the things that they're doing. So when I went into a health food store, I thought surely I would find a great product I could recommend to my patients, and then I started looking at the ingredients, and most people don't realize that the reason that they are allowed to put these toxic chemicals into our oral care products, Mike, is because it falls into the category of cosmetics. So that's why they can put these toxic chemicals in there. So I was just on a pursuit of finding something that was going to be safe, effective, clean, and green for my patients. And colloidal silver has been around for thousands of years, and it doesn't disrupt the oral microbiome. It just kills the bad bugs and not the good. So all of my products have colloidal silver in it. And I have the only toothpaste on the market that is also an oil. So coconut oil is the main ingredient in mine. Unlike water, most toothpaste is just a water-based formula. Mine's coconut oil. So I use really, really great high-quality ingredients. It's very low abrasive. A lot of people don't realize that most of what they're brushing their teeth with is ruining their enamel. Only have one coating of enamel. You're not going to regrow enamel back. So anything over a 70 on the abrasive scale is considered abrasive. So some of your toothpaste are around 200. You know, it's like liquid sandpaper. So I like something that's going to be very, very mild, and that would be baking soda. It's only a 7 on the scale. But my toothpaste is, I think it's a 32 on the scale of abrasiveness. So it's very mild, safe for veneers, all kinds of dental work. They're not going to ruin your enamel. There's nothing in there that is bad for you. I mean, it's, you know, it's hard to find a product that you can feel confident in. And I have a mouthwash. I have 3 mouthwashes, 3 toothpaste, and 2 breast sprays. So Simply Silver Mouthwash. Hopefully everyone will check it out.
Yeah, definitely. I mean, again, you know, the idea of just going and buying the big brands that we all grew up with, you know, might not be the best alternative for a lot of folks.
Well,
so,
you know, I call Listerine well, I shouldn't say it, but it has a pH of 4.2. So you're basically swishing with acid, and like I was telling y'all before, if your saliva drops below 5.5, you can get decay. So you're swishing with acid in your mouth, not to mention, the toxic stuff that's in there, and it's going directly into your bloodstream. It can cause high blood pressure, and a lot of people don't realize that Listerine was created as a floor cleaner, but it was rebranded. So you don't need floor cleaner to have a healthy mouth.
Oh my gosh. Yeah. It's so scary. But it's amazing. But thank you for at least shining some light today, Heather. I know you have a gift for my listeners. Can you describe what that is? And then describe where our listeners can learn more about you, your products, your YouTube channel, list all that good stuff.
I believe they will be able to find, it's an extra bonus chapter that I created just for your listeners. It'll be in the show notes. They can get my website. I have two websites, but because I'm also a myofunctional therapist. But simplysilvermouthwash.com is where I have all of my oral care products. You can also hire me to be a dental consultant. I'm happy to help people just navigate the world of dentistry. So, we can have a consultation. Again, I'm a myofunctional therapist, so you can always book that consultation through that website as well. And I think I have social media. You have Facebook, Instagram, and my YouTube channel is Simply Silver Mouthwash. So you can find me there.
Very good. Well, Heather, thank you very much. I enjoyed the book, and definitely an eye-opening conversation. I'll look forward to your new book. So thank you.
Thank you so much for having me, Mike.